My name's Christy, and I'm your social worker today. And what's your name, honey?
Deborah.
Okay, Deborah, so nice to meet you. Thanks for coming in and talking to me. We have a lot of information on your intake sheet that I got here. So this is what the process is about, is just gathering a lot of information to get everything we can about your story and about what's happening and how we can best help you. So basically, I just have your date of birth at October 27th of 1989, is that
Yes.
correct? Okay. And your address is 1027 Mull Avenue?
Yes.
All right, Akron 44314, okay. And a phone number to reach you at would be 330-867-3683,
Yes.
right? Okay, all right. So what can you tell me, what is the, reason for coming in today, talking to me?
Well, I became a liability to my job because I became blind, so they let me go. And now I'm just in the fear of losing my son or my son being taken away because they feel like I can't take care of him. And I just turned to alcohol, like, I'm just so depressed. Like, I just don't know what to do.
That's
Like,
really hard,
I'm
yeah.
frustrated, I'm mad because I'm going blind and I don't know what to do.
Yeah, I want you to understand too, of course, that the information you give to me today is
Mhm.
confidential.
Okay.
Nothing leaves this room, unless of course you have thoughts of harming yourself or, harming others. I don't think that's the case here today. I think that, I'm really proud of you for coming on in and talking about all this. This is a hard situation. Can I ask you what caused your blindness?
I don't know yet. Are they trying to say it's like a disease or something?
Okay.
So
And
they're not sure, like,
is it progressing rather quickly?
yes.
Yeah, that's very difficult. And you say you worked at your job. What did you do for your job? You worked.
I was taking care of patients.
So you're very ongoing on care.
Yeah.
Yes. That's very hard to deal with. Also now, so let me go back to where you said how, you have this ongoing disability, and it's causing problems now with functioning,
Yes.
correct? Okay,
Yes.
that's what I'm hearing. And it says you live with your, you live at home. Is there
Yes.
anyone else that lives at home with you?
My husband.
Okay. How's your relationship with your husband?
He's like kind of upset because he feel like I'm not going to be able to take care of our child. So,
Okay. Does
um,
he have any problems coping with any situations? Does he turn to anything other than, just normal coping mechanisms, that kind of thing?
yes.
What does he do?
Well, sometimes he drinks, and we kind of butt heads. Like, he blames me for everything because I'm going blind, but it's just, I can't help it.
I understand that.
Like, I have no control.
Right. Do you have any children?
Yes.
How old's your child?
He's 2.
Oh, okay, all right.
Yeah.
So he's pretty young to
Mhm.
deal with both situations of the drinking,
Right.
and then also the disability as well.
Right.
And I can see how your fear is that,
Mhm.
you might not be able to care for him like,
Yeah.
he needs to be. You have a lot of rights here, so you don't need to have fear that you're not going to be a good mom, because I can see you're a good mom right now.
Thank you.
Would you consider your health to be overall pretty good?
Yes.
Other than that? Okay,
Yes.
well, that's very good. Alrighty. Now, are you able to drive, or how do you get around?
Well, I did used to be able to drive, but it's just like sometimes I get like glares, so I
Mhm.
don't really like to drive. I mean, it's okay in like the daytime, but at nighttime with all the lights, it's just hard for me.
Right. So yeah, what you're saying is that it's really affecting all the aspects of
Yes.
your life now.
Right.
Right, okay. So, what we're gonna do here is, I noticed how you've talked about, your son, you've talked about your husband. Are there any other things that I need to know about, like as far as a family unit? So I'm gonna use a little tool we call the Echo Map here.
Mhm.
And what I did was I put you in the center here, okay?
Okay.
And then you can fill these in, and we'll go in these together. And basically what we'll do is we'll talk about your support system.
Okay.
So this makes the client feel really more at ease
Mhm.
and, actually gives them a little more hope, you know, before they come in that door and they realize they don't have anybody, but then they do this and they're like, oh yeah, I forgot, I have a neighbor, I have this, I have that.
Okay.
So, you know, we're gonna go through this, so, I put you in the center here, okay?
Okay.
And then, so, do you have a mother living still?
Yes.
Okay, how's your relationship with her?
It's good. She stays out of town, so I really don't
Okay.
see her a lot.
Right,
Yeah.
so she's not, she doesn't help you with the care of your son?
No.
And I'm sorry, what was your son's name?
Adam.
Aden?
Yeah.
That's so cute. Oh, and, so Aden is not, you're really Aden's support?
Mhm. Yes.
Okay, and then the father's name was, John?
Yes.
You said? Okay, so John, and he's, are you legally separated or are you married?
Well, we've been married.
Okay, all right, so, then basically you have your son and he's 2,
Yes.
and then you have any siblings or anything like
I have
that?
a sister.
Okay, okay, and then how's that relationship?
It's good. She helps me a lot. That's kind of like my biggest support system right now.
Very
She's
good.
giving me hope and strength.
Okay, I gave her a nice big line right here, because that's a very good support system for you, okay? And is she married as well?
Yeah. Yes.
Oh, okay. So, like, her husband, does he help out with, like, Adam sometimes, like, as a father role type of thing,
Yeah.
if your husband isn't, you know, quite able to do
Yes.
things? Oh, that's very good, see, so he'll get a nice, big, strong line right there too. Whereas your mother is kind of like a crooked, line, because it shows a little bit of a, decline in a relationship, you know. She used to be more of a support system, and now she's not as much. And then, do you, have any neighbors or anything that help out?
Yeah, Mike, he's a neighbor. Like, he sometimes gets my son off the bus at school or put him on the bus. Yeah.
That's very, very good, okay. Does he help out any, like, with yard work or anything like that, or help out around, you know, that kind of
Yes.
thing?
Yeah,
Okay.
so my husband is at work or.
Oh, that's really good,
Yeah.
all right. So, see, I think that you're seeing that you do have more support than
Yes.
you really do feel
Yes,
like you
'cause
did,
sometimes
right?
I feel alone, but that really helped me see that I have a support
That's
system.
really good, thank you. Alrighty, so what we're gonna do now is, you know, we've talked about how you feel, we've talked about how this disability is really affecting your life. So now we have to figure out what kind of coping mechanisms we're gonna use to get you to feel like, you know, you have a lot of hope in your life, you know, even living with a disability, you have a lot of rights, you
Yes.
really do. And you also need to learn, you know, we're gonna teach you how to do, more coping mechanisms, you know, being, I'm not gonna say a better mother to your child, but being more attentive to him, and now you'll have the time to do that since you'll be at home, you know,
Yeah.
and not working, so looking at that can be a positive aspect for that, you know. So, the fear of, would you say the fear of living a new life almost is kind of what we're feeling right
Yes,
now?
I'm just afraid that I'm just gonna go blind and can't do
Okay,
the things I normally do, so.
okay,
Then I started drinking, and we have a family history of drinking, so I just don't wanna be
Okay.
an alcoholic and just be a failure to my son, so.
I'm sorry, you said there, so you're saying there is a history of alcoholism?
Yes, my father
So-
was an alcoholic.
I'm so sorry to hear that. Is he living or is he deceased?
He's deceased.
Oh, I'm so sorry to hear that. So, you know, that's one thing you do have to keep an eye on, and that's why we're gonna give you some more coping mechanisms, so you don't have to turn to alcohol, you know,
Okay.
so, cause that would be in the best interest of you and your
Mhm.
husband and your son,
Right.
but especially your son, you know. So there's a lot of things that we're gonna make some goals on, and we're gonna, work together on, and whatever
Okay.
you feel comfortable telling me, you tell me, and if there's something you don't, then that's fine too.
Okay.
And as long as you need to take for this, we'll take, so there's no rush, there's
Okay.
no time limit, no time frame. But, what we're gonna do is, I'm gonna ask you, would you be open for assistance to help you with like some, you know, learning mechanisms to get you through to a new life type of thing.
Yes.
Yeah, okay.
Yes.
So what I would suggest is, United Disabilities is a wonderful organization for those that have disabilities.
Okay.
And basically, they can send someone out to the home, okay? So like, especially as your eyesight gets worse, you know,
Yes.
so they need to evaluate what situation you're living in to see what we can do. Like maybe a ramp needs to be installed, or your kitchen needs to be modified somehow, or even
Okay.
bathrooms can be modified, so there's no step, you know,
Right.
to make everything more accessible for you.
Okay.
Okay, so that's a lot of good news there, you know, and a lot of that is actually paid for, okay, by United Disabilities themselves, and also as time goes on, I'm sure that you're gonna probably stop driving. Would that be the case? Do you think?
Yeah, 'cause it's getting bad.
Okay, all right. So that kind of scares you when you're on the road, huh?
Yeah.
All right. So we have what's called SCAT. Metro. So that's a wonderful thing too, because it drops you off right to the door.
Okay.
So, you know, they help you into the bus and they help you off the bus and they drop you right off to the door. So that basically, you know, you can get to your appointments or the store or anything and kind of feel like you're still independent.
Right. Sounds
Okay.
good.
So, so we've got a lot of good goals here, and so you'd be willing to have someone, even an occupational therapist, come out to see
Yes.
you?
Yeah.
Oh, that's fantastic, good. So what we're gonna do is, I'm also gonna touch on something else. It might make you feel a little uncomfortable, but being in the situation that you grew up, with an alcoholic, it's, very hard to process those feelings,
Right.
you know? And so, we tend to blame ourselves, and we tend to almost like turn to somebody to marry someone that has the same issues type of thing. So what I'd like to do is, ask you if if you'd be open to checking out either Al-Anon, which, I don't know if you've ever heard of Al-Anon before. It's it's an organization, a therapy, you know, you join, and it's basically for the families of alcoholics, you know. And it's a very good support system, totally anonymous too, so that's always good to know. And then, also there's another organization, they have online, you can check out freely at your own time, and it's called Adult Children's of Alcoholics, you know?
Yeah.
So I think that's what, if you'd be willing to do that, I think
Yes.
that's one of our goals we're gonna set up here. So, basically, you know, you don't have to feel like, you know, you don't have any choices or that you don't have a future, you know?
Right.
Cause you're gonna do very well with this.
Okay.
And, so I can see you're a very loving, supportive person, mother, you know, friend, yeah, all right. So we're gonna meet up, probably in a month here, and I wanna hear all the different things going on, if that's
Okay.
fine with you?
Yes.
Okay, and what would be more accessible for you to come into the office, or for me to come out to your home? Cause we can do either one.
We can do an in-home visit, just so you can see like more what I'm going through
Okay.
at home.
That's perfect, yes. And then, I would like to see if, maybe in that month, you can tell me that you've checked out some of those resources, that
Yeah.
type of thing? Okay. And then before you leave today, I'll give you the number for United Disabilities, and then we'll also give you a number for, any other, organizations, SCAT.
Okay.
We'll get you a schedule for that. And, we'll get you on your way very shortly here, so nice to meet you, and thanks
So
for
nice to
coming
meet you
in.
too. Thank you.
I can't wait, and I'd like to meet Adam someday, and your husband, and even set up, family counseling if you're willing to do that.
Yes, I'm willing to.
All right, well,
Thank you.
thank you, very nice to meet you.
Nice to meet you.
All right.